So today we have Jen Raminick, a speech language pathologist at CHOC Hospital.
Thank you so much. Thank you guys. I'm super happy to be here, and I work at CHOC Children's Hospital, just right down the street. I have been working with there for almost 10 years, and I work with everything from preterm babies to up to 25-year-olds. And I love science, and I love the science of speaking and swallowing. Specifically, I love working in our ICU setting at my hospital. So we get to help kids that never learned how to eat learn how to eat. As a speech language pathologist at CHOC, you can be inpatient, which is where I work. You can be outpatient and see kids in the community. You can work in clinics where people come for quick visits with other specialists and you're part of that clinic. Or you can work, like I said, with our feeding program. My path to speech pathology was not a straight line. I graduated from Michigan State, go Spartans, with a bachelor's in communications. And then after that, I was gonna work in the music industry forever. And I moved then to San Diego, working with metal bands in the music industry. And it just wasn't my life passion. And I really wanted to find something that I was excited to do every day. So I went back to school. I got my master's from Cal State Long Beach in communication disorders. And from there, I took a medical internship at CHOC Children's Hospital, and I've been there ever since. What I do with speech language pathology is pretty specific, working with kids in a hospital. When you go to school, when you get your master's for speech language pathology, it's usually more of a general education because you can do so many things as a speech language pathologist. So after I went to grad school, I had to do internships, I had to take coursework, I had to work through mentorship and also do a lot of networking. Once I kind of decided that I loved the aspect of swallowing and swallowing disorders, I worked hard to get my board certified swallowing specialty certification. So I have this cool video that shows what a speech therapist actually does in a hospital that gives you more of an inside look of what that looks like with patients.
Our speech language pathologists are a dedicated, passionate team of professionals who are constantly wanting to grow and learn because we want to provide the best service to our patients.
My name is Morgan Brumley. I am a speech language pathologist and I've been here almost 6 years. I am responsible for evaluating and treating patients with communication disorders and feeding and swallowing disorders.
Speech pathologists get to do a wide range of tasks. So we can work with people on their cognition, communication, feeding, swallowing, oral rehab, which is hearing. We work in concert with audiologists. So we have a very large scope.
We are blessed to have access to equipment and technology. Pair that with the expertise of our speech language pathologists and their passion for serving children with complex needs, then we're able to provide excellent care to our patients and their families.
I've learned most from the patients that I've served and from the colleagues that I have worked with and alongside.
The most rewarding part about my job is that I get a front row seat to the children and their milestones that they meet, saying their first word or taking their first bite.
I'm just super proud of the group of SLPs that we have and the path that we've taken and the vision that we have for the future.
I love that video because it really highlights all the different things that we do as speech language pathologists. Most speech therapists do work in schools, so about 53% work in like elementary, middle, and high schools. After that, there are speech therapists that work as in a university setting as professors, or they're working on research through a university. Then we also have speech therapists that work in healthcare. So somebody like me that works in a hospital, but also we have therapists that work in an acute rehab facility, which is where people go after they're not super sick, but they still need help with their communication or maybe with their walking or all of the above. We have therapists that work in long-term healthcare facilities, so like things like nursing homes or where patients basically live. Also, we have speech therapists that own their own business and they have their private practice and they hire other SLPs to work there as well. And then we have other, which is some speech therapists can work in a corporate environment, some speech therapists can work in government. And I did make a note that these don't add up to 100 because you can work in multiple different settings. So a typical day for me in my role is totally different. Every day is different, which is something I love. I have worked in jobs before where I did the same thing every day and it was super boring. And so I love that every day I see different patients, I work on different floors, I work with different teams, I'm solving different problems, and it keeps my day really exciting and helps make me passionate about what I do. Typically, I see patients for most of my days, so between 4 to 8 patients a day. A big part of what I do is working in our ICU, so babies that are really sick that maybe had a really bad viral illness, and because of that, it makes it very difficult for them to breathe. I treat a lot with our physical therapists and our occupational therapists. We work together. A lot of times our patients, we have the same patients and they have different needs. Another reason why my day is always different is because I wear a lot of hats. So a big part of my job is seeing patients, but then I'm also doing all these other things. So I'm a team lead within our department, so I create courses and work with other education providers to give courses. We have a clinical practice committee at our hospital, which is an organization. Each department has their own clinical practice, and I run the meetings where we get all together and we talk about, what is your department working on? Okay, that sounds a lot like this other department. Why don't you guys work together and facilitate change in this way? Currently involved in 2 different research projects at our hospital. Within our hospital, I've been able to create program development, so add different programs to our hospital that weren't there before. And then a big part of what I do is I'm a teacher and mentor, so I almost always have a university student that I'm working with that she comes with me for the first half of her internship. So one of the neatest ways that I think I use technology is through our instrumental studies for swallowing. So we have 2 ways that we can look at swallowing with instruments. We have, it's called a modified barium swallow study, which is where we actually do a moving x-ray and I feed patients this material and then I can watch it in the x-ray go down to their stomach and make sure none of it's going down the wrong way, like to their lungs. And when we do that, this is the substance that I give them. This is called barium, and we can make it in different thicknesses. So this is what it looks like. This one that we're going to play first is what it should look like. This is normal swallowing. So you can see the liquid shows up really dark. That way we can see where it's going. And then all the cavities are light. So we can see this tube is going down to their stomach. That's where we want it to go. There is a tube in the front that goes to their lungs, and we don't want it to go there. And then this is what happens when it does go down the wrong way. This is what it looks like. So again, you can see the dark liquid. It starts off looking okay, but then we start to see some of the liquid go down the front. That's to the tube to their lungs, their trachea. So one of the things I love about doing instrumentals is that I get information right away. I can actually see what's happening and can see from here. I have studied the muscles and the anatomy and the physiology of what swallowing should look like, so I can see what's going wrong, where do we need to work on, can we try different strategies or different types of nipples or formula to see if we can help this baby. Another way that we use instrumental swallowing exams is this. It's called our fiber endoscopic evaluation of swallowing. And what it is, it's a long tube, a long catheter, and on one end there's a camera, and then on the other end it's like a remote control. So we actually stick the camera up a person's nose and feed it down to their throat. You can actually keep that camera in for a full meal and have your patients eat and drink for a full meal and get to see how they're swallowing. So this is one of the cool parts of, one of the cool uses of technology that I love at my job. I wanted to walk you guys through an example of how I use all the technology, innovation, design, and entrepreneurship at my job through an actual example, kind of like a case study. So We didn't have a fees program when I started at CHOC. We have certain patients that we can't take them down to that machine that I showed you. So this is a video. This is obviously a much older patient than I see, but it's a good example of why we would want fees.
Or does it feel clear? Feels clear. And it looks clear too, right? We're not seeing anything.
So this is what it looks like in the moment.
All right, here we go, one piece of each.
We dye the food blue so you can see it.
Does it feel like it's all gone?
So for innovation, we had to start a program from scratch. So we didn't have any other resources to fall back on. So we had to figure out how we were going to, we have to create policies in the hospital for everything you do. So we had to make a policy for fees. What type of patient would we use it on? What are the steps when we do an evaluation? How do we know somebody's competent enough to use it? So we had to create competencies that shows like, yes, you, Jen, are proficient enough to use this. You are able to go use this on a patient. We had to collaborate with many different departments on everything. We had to go to quite a few different courses. With design, this isn't like a super hip and cool design, but it's definitely an element of design that was necessary. So we had to design our storage closet. So they gave us a closet, but our equipment that we had and our policy that we created had all these rules for how this had to be stored. So there were some design challenges with that. And then I think this is one of the neatest parts with our fees program. We didn't have money for it. It was super expensive. It was like $88,000, and we couldn't just go to my boss and be like, we need $88,000, please. We actually had to write a grant for this. So we worked with, our hospital has a grant program, and so you can apply to be a part of the grant program, and with that you have to write a proposal to justify your needs. So we had to say why we needed this, why it would benefit the hospital, why would it benefit our patients. We had to create a budget for that, so we had to say what are the immediate expenses that we have in order to purchase this equipment, but also what are the ongoing expenses that we'll need in order to keep this program up and running. We actually had to write a pitch, like a Shark Tank pitch, and we had to go present it in front of a room of hospital executives, but also like bank executives and community members that wanted to donate money. We had to like do this whole Shark Tank pitch. But we did receive the grant, and we did start our program in 2018.
Did you have any challenges after the pandemic?
Yes. So we had, I would say the entire pandemic was a challenge. We've just had a lot of staffing changes and turnover, so we're still trying to get back to our, get back to what we had with staffing. Any other questions? Yeah.
Did you have any mentors throughout your career?
Yes, I have a great, and I think that's so important, especially when you're going into a role that you don't know anything about, to have a good mentor that you trust and you can build a relationship with so that you can learn more. Yeah.
Do you have any advice for us, for those who wants to start planning their careers?
Yes. Well, I think be flexible, be open to opportunities. I think if I would have just put my nose down and said no, I'm working in the music industry for the rest of my life, I would have never found this area that I'm really passionate at and really successful at. And I think being flexible to different opportunities and different learning experiences is a great idea. Yeah.
Was it easy to switch from one career to another?
It wasn't challenging, just switching gears, I guess. It took a long time. You just have to deal with graduate level coursework, which is challenging. The switching careers wasn't hard, but it was hard starting over.
All right, Raminick.
Thank you guys so much.